Civil society organizations have cited an inadequacy of health workers and teachers, especially for the children at refugee camps, where the pressure on social services is becoming overwhelming. They call upon government's inclusion of children in the financial year 2025-2026 budget.
Uganda is the highest refugee hosting country in the world, and we got to know sometime in April this year that we now have about 1 million refugee children in the country. And these put pressure on the social services that are within the communities where they are. The schools there, in the communities where they are overwhelmed. We are saying that in the budget that is coming up of 2025-2026, that as government puts this in place, they help address issues of staffing, to help also bring the health services closer to address issues of malnutrition with children in these areas.
There was a call for the operationalization of early childhood learning policy and the provision of free education at pre-primary level.
I'm tired of talking about it as existing because it is creating discrimination amongst children. If the Education Act of 2008 specifies that education in Uganda will begin from preschool, primary, secondary and tertiary, how are we fronting free and universal education at primary and not free education for nursery? Are we truthful to the children?
CSOs also emphasized the need for government to address the skyrocketing education fees, which continue to burden parents and impact learners.
We would want government at least to rein in and keep abreast and in touch of the realities on ground to ensure that this education cost doesn't skyrocket, because we appreciate the value that education has right from the foundation of a child. So this is something that we want government to keep in check, at least in the next planning and budgeting process for 2025-2026.
With over 1 million refugee children, the call for the employment of more health workers and teachers has become urgent. Marion Awori for UBC.